Hello friends, in today's video we are going to learn about the Somogyi phenomenon. It is seen in a diabetic patient who is on insulin. Somogyi phenomenon or effect is also known as a rebound hyperglycemia or post hypoglycemic hyperglycemia because patient present with the early morning hyperglycemia or fasting hyperglycemia. First of all, let's learn about the counter-regulatory hormone. A glucose level in our body is reduced by the hormone known as insulin. That is why in the diabetic patient we give the insulin. And the glucose level in our body is increased by the hormone known as a glucagon, growth hormone, cortisol and the epinephrine. Now, what is Somogyi effect? Somogyi effect is occurs due to when a diabetic patient takes the night dose of insulin. If the dose is high, then sometime what happen in the midnight patient having a hypoglycemia. So, as a counter regulatory hormone are released at this moment like the cortisol, glucagon, epinephrine and the growth hormone are released in the midnight, which leads to the early morning hyperglycemia, fasting hyperglycemia. This is known as the Somogyi effect or the Somogyi phenomenon. As we can see in this chart, a patient having a normal level of blood glucose around mid at night time around 9 to 10 p.m. Patient takes the dose of insulin at this time and which can lead to the hypoglycemia in the midnight around 3 to 4 a.m. Hypoglycemia at the midnight, which can lead to the release of counter-regulatory hormones like cortisol, glucagon, growth hormone, and epinephrine, which leads to the hyperglycemia in the early morning. When we check the patient's fasting blood sugar, it comes on the higher side in the early morning. Now, how to diagnose a Somogyi effect or phenomenon? For the diagnosis, we have to check a blood sugar level in the midnight around 3 a.m., which comes as a low or hypoglycemia in the midnight. So, as a part of treatment, we have to reduce the night dose of insulin because the normal tendency of the doctor when the fasting blood sugar comes on the higher side or more, then we increase the night dose of insulin. But in this case, we have to reduce the night dose of insulin to control the early morning hyperglycemia. Thank you.